We don't know exactly all of the details around the contagious periods with this virus. We know that for a lot of viruses, you tend to be excreting virus up to the point when you become symptomatic and during that time. But one of the hallmarks of COVID-19 is fever and cough. And so clearly, if you have cough and you're coughing, then you're liberating the virus out. And that is a greater risk for then spreading it not only on surfaces, but also to other individuals. Respiratory viruses are spread by either aerosolization or droplet. This particular virus is a droplet spread virus. And as a consequence, close contact is a means for spreading, as is contaminating your hands and then your hands touching your face, your mouth, your eyes, your ears, etc. In order to prevent respiratory viruses from spreading, then you have to do these things like social distancing to keep not so close to the next person, make sure that you're washing your hands, and make sure that if you're symptomatic, then you're staying away from other people. One of the things that I think most people don't think about is how many different individuals they interact with on a daily basis, how many times they may be touching surfaces or that others have touched. And as a consequence, when you get together as a group, you actually don't know with everybody else in that group how many variables that they may have come in contact with, which could increase your risk. When you're going to go and do one of these everyday things, you need to think about where you're going, what's the likelihood you're going to be put into a situation where you may come in contact with somebody who could potentially be spreading the virus, or contaminated surfaces. And if you're unsure, then maybe you should be checking with wherever it is that you need to go to ask them what type of measures they have in place in order to reduce the likelihood that the virus may be present in their environment, whether they're cleaning surfaces or maybe even recommending that you don't come to that particular business. It's always easy to criticize governments when you're not sitting in the chair. And I think out of fairness, Premier Moe and Prime Minister Trudeau are making recommendations based on the data that's being given to them by public health and studying what's going on against the world. And I think that we all need to realize that these are difficult times and we need to be supportive of our government's efforts in order to deal with this situation.